So we are going to have Hannah speak about health and concierge medicine versus primary medicine. And I want to tell you guys a little bit about, health is super important. It is the basis of our, lives. If we don't have health, we don't have wealth, we don't have physical health, we don't have anything. So it's kind of like that bottom base of the pyramid, money's on the way top. It's, small portion of our lives, but like the food group, health is the bottom rung. And so if you don't have that, well, things kind of fall by the wayside. So without further ado, I'd like to have Hannah speak about that. You have screen sharing capabilities, I think. If you don't, let me know.
It's okay, I don't need them. I'm not using a presentation, but thank you, Yasenny. I completely agree with you. Your health is your wealth. And I think that in our culture, there is not a proper emphasis on health. There's a proper emphasis on health when we're already sick, but not preventing illness and disease. So for those of you that don't know, I'm Hannah. I'm with Insight Life Care. We're a concierge medical practice. So it's basically like primary care, but on steroids. So like much, much higher level of care, attentiveness, and service. We're really committed to our patients and developing relationships with them. So little did you guys know that you're showing up for a pop quiz today. So I would really appreciate it if you would all just bring up your chat and just go along with it. So the first question is, or statement, I guess, is please type yes in the chat if you believe that healthcare should be affordable and accessible to everyone. I hope everyone clicks yes. All right, awesome. All caps. So that's awesome. Yeah, me too. And that's part of my why for being here today. I'm really genuinely passionate about the fact that healthcare should be affordable and accessible to every single person in the whole wide world. So our next question is, what is preventive care? And why is it important? So what are some aspects of care that help you before you get sick or can prevent you from getting sick? Wellness checks. Yeah. Proper sleep, vaccines, lab work, dentists, working out. Yeah, those are all great answers. Diet, yeah. So preventive care in its simplest form consists of wellness visits, illness screenings, and patient education. According to the CDC, almost 40% of annual deaths from each of the 5 leading causes of US deaths are preventable, which means that with more effective preventive care, approximately 260,000 Americans would not die prematurely each year. So who's responsible for providing this preventive care? You guys can answer in the chat. Is it yourself, your dentist, medical care providers, yourself, each individual or family, yourself, providers? Interesting. Myself. So a lot of you guys think that that's a personal responsibility. I agree that it's personal, but I also think that your primary care doctor should be responsible for providing you with the correct education and tactics for prolonging your life. So if your primary care provider, apart from yourself, is responsible for that patient education, it would make sense to spend quite a bit of time with them, right? So how many hours do you think Americans spend with their doctor each year? So this is just their primary care doctor, not including any specialists like cardiologists or dermatologists or anything like that. Just your primary care physician. Less than 2 hours, 30 minutes, maybe 1 hour, 15 minutes, 2 to 3 hours. Yeah, those are all great answers. And it was actually a trick question because the average American only spends a total of 26 minutes with their primary care doctor all year. So with less than 30 minutes per year dedicated to preventive care, it's no wonder that Americans are dying from preventable diseases at an alarming rate. Of course, we spend a lot of time with ourselves, but we tend to indulge ourselves in temporary pleasures, which most likely aren't going to benefit our health in the long run. Yes, chocolate. Me too, me too. All right, so you guys did a great job on your quiz. But why don't doctors spend time with their patients? There's a couple of reasons, the largest of which is health insurance. And you might be saying, what do you mean health insurance prevents people from spending time with their primary care doctors? Isn't that literally the point of health insurance? Yes, it is. But without getting into too many details, doctors get paid by billing their patients' insurance according to billing codes that identify the services they've provided. But guess what aspect of healthcare there's no billing code for? Time. Doctors do not get compensated for the time they spend with their patients. So technically, the more time they spend with an individual patient, the more money they are not making. So how do primary care doctors make money, or any doctors for that matter? They see a lot of patients for a short duration to increase the number of services they can bill to the insurance company and decrease time equals money lost. Many organizations and insurance companies purposefully limit or decrease doctor-patient time and align financial incentives for doctors with the plan's commitment to greater profit and other goals that are completely unrelated to those of doctors or patients. It's all about making money. So another reason that health insurance prevents Americans from spending time from their doctors or with their doctors is deductibles. A deductible is the amount you pay for healthcare services each year before your health insurance pays its portion of the cost of covered services. The average deductible for a person on an employer-sponsored health insurance plan was $1,600 this year. And that number is much, much higher for individuals that are on like individual plans, not employer-sponsored. So that means the average American does not have insurance covered healthcare until they've spent $1,600 of their own money on medical services. So basically, they have to pay for all of their medical visits on top of paying for insurance. Crazy. So now I've said a lot of bad things about health insurance, but I want to emphasize this. Health insurance is incredibly important, and I recommend every single person have some type of coverage. But you have to remember, health insurance does not equal health care. Health insurance is a financial tool that protects your assets in case of a healthcare emergency. So you might be wondering why I just ragged on health insurance for 5 minutes, but those facts are the basis for why Insight Life Care exists. So for those of you who know who Bucky Fuller is, he once said, "You never change things by fighting against the existing reality. To change something, build a new model that makes the old model obsolete." Across America, physicians like Dr. Nussbaum are creating a new standard of primary care. Through our concierge model, we remove all of the typical pain points from modern primary care by eliminating the dependence on insurance companies to reimburse us for our services. Our patients pay us directly and in turn receive unlimited access to their doctor at an unmatched level of service, care, and attentiveness. Our patients have their doctor's personal cell phone number, which they can call, text, video chat 24/7, any day, any time of day, whether it's 4 in the morning or 3 in the afternoon. Our patients are guaranteed same day and next day appointments. There's no waiting period for scheduling or when they come into our office. So many doctors' offices and all types of offices advertise comfortable waiting rooms with Wi-Fi and amenities, coffee, tea, all of that stuff. Well, I'd like to tell you guys that our waiting room is definitely comfortable, but our patients don't spend enough time there to need Wi-Fi or amenities. When they walk into our office, they walk into the exam room and the nurse is with them within 2 minutes and the doctor is there as soon as the nurse is complete. So we schedule all of our appointments in hours rather than minutes to give our patients enough time to accurately express their concerns and needs. There's no such thing as coming in, waiting, seeing a nurse for a few minutes, waiting, and then getting to see your doctor for maybe 10 minutes, maybe 15 minutes, and you're only allowed to talk about 2 issues when you're talking to their doctor. We don't do that. We give you as much time as you could possibly need to feel comfortable to express yourself, go over anything that you're worried about, anything that you want to move forward with, anything like that. Another thing we do is we advocate for our patients on an unmatched level. We schedule, manage, and follow up with all out for them. So we never just hand them a prescription and a well wish. We actually contact the specialist office or diagnostics office. We schedule the appointment. We do everything for them. All they have to do is show up. Some other benefits of being a patient of Insight Life Care are having all of the lab work done in our office. Our doctor takes care of you in the hospital, and we can take care of you wherever you are, whether it's in our office or yours, your home, an assisted living facility, or remotely via telemedicine. And there are no copays, no additional costs, nothing. One flat monthly fee, and you do not have to have health insurance to be a patient of Insight Life Care. All right, so back to the chat. Who here knows Blockbuster and Netflix? Yes, I'm sure everyone knows. So who still goes to Blockbuster? Does anybody still go to Blockbuster? Does Blockbuster still exist?
People in Alaska. It's the only one left.
Yeah, maybe. No, because Netflix made Blockbuster obsolete by providing the same service at a lower cost with a higher level of accessibility and use. So think of Insight Life Care as the Netflix of primary care. You pay a flat monthly fee and you receive unlimited access to all of our concierge level primary care services, regardless of whether or not you have health insurance. By cutting out the middlemen, which are insurance and corporations, we're able to lower the associated costs and increase the amount of time we spend with our patients. Patients like Martin, a 56-year-old construction worker with no insurance and some complex medical conditions, who is paying over $900 a year on just one of his medications. Now we've helped him manage his chronic heart disease through conversations, guidance, and assisting him with finding a specialist that we've negotiated a cash price with, thereby lowering his total yearly costs for healthcare, and have helped him become much more satisfied with the direction he is taking his physical and mental health. Or a patient like Judy, who is a high-level finance executive who is mostly healthy with great health insurance, but she was unhappy with the level of care she was receiving for the amount of time she was waiting. Now Judy loves being able to see Dr. Nussbaum on her schedule and being able to text and video chat him any time of the day while she is traveling for work in the States and abroad if she has any health-related question. So somehow in the last 30 to 40 years, we've turned routine healthcare into a crazy contraption that's complex and costs a ton of money. And I don't know why that is, because routine healthcare that you and I use is not expensive and it is not complex. But I'm not a doctor, so I happen to think that internal medicine is pretty complex. But physicians have an oath to their patients, not to insurance companies, the government, and not to administrators. So what we've done at Insight Life Care is remove those players from the equation and in turn developed the strongest, most organic relationships with every single one of our patients, which results in better health outcomes and happier patients across the board. Simplicity is the ultimate sophistication. Thank you.
Does anyone, oh my gosh, think that that was the most amazing, thing, like the quiz, everything. I loved it, Hannah. Anyone have any questions for Hannah?
I do have a question. Hannah, how has COVID affected the business, good or bad?
Yeah.
And tell me a little more.
Yeah, that's really interesting. So last March, I think it was like the second week of March when the world turned upside down, we decided to go completely virtual with our practice, only offering telemedicine. To this day, almost 12 months later, we are still almost 100% virtual. Last March when we did telemedicine only, we never would have thought that we'd be doing it a year later, but a lot of our patients are high risk. They are either elderly or they have conditions, anything like that. So in order to lower the overall risk for all of our patients, we've decided that it makes most sense to do most of our visits via telemedicine. We do see some urgent appointments in person, when deemed necessary. We are doing lab work in the office for our patients as well, just so they don't have to go to a lab or somewhere else with a ton of people. We just allow one person in the office at a time. I think as every business has experienced, there's been some up and downs through COVID as we've been differing our understanding of COVID. You know, we were, you know, in terms of practice growth, we were maintaining a, you know, a positive growth period throughout most of COVID, which we're really blessed to have, you know, experienced and maintained our solid patient base. We're super lucky to have the most amazing patients in the whole wide world that are just extremely understanding and compassionate for our decisions, that, you know, they understand that we're trying to protect them. We're not, this isn't about us or anything other than them. So it's been interesting. Our staff is almost fully vaccinated. So once we're all fully vaccinated, we're going to be opening the office again. We've been slowly increasing the amount of appointments we're doing in the office. But by mid-February or the end of February, we should be up and going again. So that's going to be really exciting. I think it's been tough in such a patient-centered environment to be virtual because it's not the same. You don't have the same level of communication or interaction or understanding when you're just seeing from the chest up on Zoom call. There's just like so much communication that's not verbal. And that's especially really, really, really important in primary care. So I'm personally so excited to get back in person. But thanks, Mike, for asking that question. I think COVID has been challenging for all of us, but how we overcome and just adjust and adapt has been the most important facet of it.
Oh, thanks, Hannah. I appreciate it.
That's excellent. That couldn't have been a better question. I don't know. I have a question regarding telemedicine though. Is he going to continue to do telemedicine even though he goes into the office?
Yeah, so the reason we were able to adapt to telemedicine so quickly is because we've been doing it for 7 years. You know, one of the patient examples I gave was Judy. She travels a ton for work, and so she's always done telemedicine. And same with a lot of our other patients. If they're traveling or they just don't feel like leaving their house because it's not like a huge deal that they need a physical examination, they do telemedicine. So we've always done telemedicine. I think the amount that we'll do will definitely increase, you know, post-pandemic, just because people have gotten so used to it. They're like, oh, this is awesome. I can literally like go on my phone. It's 4 o'clock in the afternoon. I can go on my phone. I can log into my patient portal. Oh, okay, there's an appointment available for 4:30. Awesome. I can talk to my doctor, have a full visit in 30 minutes, just from the comfort of my couch. So I think it'll definitely be more prevalent moving forward.
Excellent. Excellent. And are there different types of telemedicine? Like, does he do remote monitoring or anything like that?
Yeah, so traditional like telemedicine at its core is really just having a virtual visit with a patient. There's an overarching kind of category that telemedicine is included in, and that's telehealth, and that includes all aspects of remote care. So we do have a super robust remote patient monitoring platform that many of our patients take advantage of. So we give them a little device and we can monitor their blood pressure, their pulse, their oxygen saturation, and 6-lead EKG readings just from that device that's uploaded to a database via Bluetooth, and Dr. Nussbaum can log in and look at anyone's numbers at any time. We just implemented that, you know, after the pandemic began, and it has proven so useful. I mean, we've been able to prevent some cardiac events just by getting a notification from the EKG monitor, and we're never going to make that go away. If anything, we're going to try and make it a little bit more accessible for our patients, because right now the way that we're able to make it so we're not losing money through it is by actually doing that through insurance. So that's one of the, actually it's the only thing that we charge insurance for if our patients have insurance, and our patients without insurance have to pay like $20 a month for it. So if we could free for patients, that would be really ideal.
That's excellent. And I know that a lot of, you know, doctors' offices, urgent cares and things like that are still doing stuff like that. So that's good that you guys are still doing that. Any other questions for Hannah?
I did have a question. So do you all service children as well, or is it just adults?
So Insight Life Care is an adult-only practice to serve anyone 18 years and older.
Okay.
Yeah.
Where are your locations at?
We're located in Brandon, right next to Brandon Regional Hospital. We do house visits, like we'll meet anyone where they are. So we have 2 different membership levels. The lower level of membership doesn't include home visits or, distance visits, but those can be added like a la carte, you just pay cash for them. But our higher level of care includes home visits wherever you are, and that's really ideal for anyone that's homebound or living in a type of independent or dependent living situation.
Excellent. Well, Hannah, can you put your information in the chat, just if anybody wants to, learn a little bit more about business, they can learn about it. But thank you so much.
Yeah. Can I just add one thing
Yeah.
that I haven't mentioned yet? So when the pandemic started, we realized that a lot of primary care offices weren't set up to take care of their patients as quickly as we were via telemedicine. So something we'd never done before is we actually opened up appointments to non-members, so anyone in the community could schedule an appointment. And we're still doing that because it's been so helpful, especially to individuals without health insurance. It's $35. Anyone can schedule an appointment online. It's telemedicine, and you can have a conversation with a doctor. No insurance required. There's no continuing care relationship there, but it's an excellent opportunity to avoid an urgent care situation where you're sitting in a waiting room full of other sick people for like 3 or 4 hours. And then something we've done more recently, which is also available to anyone in our community, not just members of our practice, is in-home COVID testing. So we can send a technician to your house that does the nasal pharyngeal swab. It's a PCR test, which is the gold standard of COVID testing. It's 99% accurate, and you get results within 24 to 48 hours. So that's been extremely helpful for a lot of people. So if you guys know anyone that's been exposed to COVID or is having symptoms, please call me. We can have a technician in their house the next day testing them for COVID. They don't have to go anywhere. If they have insurance, it's completely free. If they don't have insurance, it's $150. So I just wanted to add that because COVID is rampant right now. Even though we don't hear as much about it, it's worse than it's ever been in our area. Brandon Regional Hospital and South Bay Hospital have never had as many COVID cases as they do right now. So mask up and social distance.
Yay.
That's it.